Hi, Kinesiology 1018. Welcome to our lecture on flexibility and low back pain and low back health. Okay, today we're going to talk about what flexibility is, different types of exercises to improve your flexibility like stretching, some of the factors, some of the physiological, what's going on when we stretch or create more range of motion. And we'll talk about how to create our own flexibility program, and then we'll get into more low back health topics to help you maybe prevent or manage low back pain. Okay, so some things we need to know first. Range of motion is the full motion available at a joint. So this is your flexibility at one joint. And flexibility is joint specific, so each joint has its own range of motion or its own flexibility. This is determined partially by the joint capsule or the joint structure. So all of those structures that surround the joint, how that joint is shaped, how the connective tissue attached to that joint to either give it some more stability or give it more mobility so it can move more. Okay, soft tissue also plays a role. So soft tissues like skin, fat, connective tissue, muscle, ligaments, nerves, all of this other tissue that is not bone also play a role in flexibility. They can either allow or restrict range of motion. Within those connective tissues that support the joint, like the ligaments, which connect bones to other bones, they have compounds called collagen and elastin, which collagen creates structure and elastin allows some flexibility and pliability within that tissue so that ligaments aren't too stiff, but they're not overly flexible. So they're just enough to stop range of motion when we don't need it and keep that joint solid and intact. Okay, our muscles also play a role. We have proprioceptors, which are nerves that are inside of our muscles, inside of our body that tell us about what position our joint's in, how long or how short our muscle is. And we also have different muscles that push against each other. Antagonist muscles are muscles that are opposing a muscle that is trying to produce some kind of force. So when you're trying to contract your biceps, your triceps relax because they're the antagonist or the opposing muscle group. If the antagonist is on too much, that can restrict motion at a joint. And we also have different degenerative conditions for our joints. So arthritis is a condition with joint pain, joint stiffness, joint inflammation. We can have it as osteoarthritis, which is single joint specific. So for example, we have knee osteoarthritis in the image above. That image shows the breakdown of the cartilage within the knee joint, which is going to restrict range of motion, cause pain, cause inflammation. We also have rheumatoid arthritis, which rheumatoid arthritis causes a swelling within the joint because the immune system is attacking the joint. It's an autoimmune condition, which is specifically affects the hands and the feet more than other joints because those joints are causing more movement. Okay, we move our hands and our feet more than any other joints. So we see more of that inflammation and damage at the wrist and the hand. One of the things with this is osteoarthritis, we can replace that joint. Okay, so we can repair, not in the best case, but we can still repair that joint. With rheumatoid arthritis, we cannot repair every single joint in the body. It's an immune system problem, not really a joint problem, but it causes the symptoms at the joint. And we also have different types of flexibility or our ability to achieve different ranges of motion. So static flexibility is our ability to hold end positions in range of motion. Think about this as the furthest you can stretch. Dynamic flexibility is our ability to create range of motion within our body and actively control it. So think of it as more static flexibility, where you can get to. Maybe if you're pushed or if someone's moving you, what's the end position you can get to without getting hurt? Dynamic flexibility is our term for kind of like mobility, ability to create motion and be strong enough and coordinated enough to hold that new range of motion. So how far can you move your leg and keep that position. Dynamic flexibility is much more important when it comes to more dynamic athletic activities or faster paced activities. We see more static flexibility in situations where you are maybe put into end ranges of motion without wanting to, or as a part of maybe a sport. So wrestlers require a large amount of static flexibility because they do have to achieve some very further end ranges of motion without getting hurt. Dynamic flexibility we see in other sports where we have to put our bodies into odd positions at end ranges of motion with some kind of control. Okay, so what determines our ability to achieve range of motion? Okay, first it's the joint structure. So how's that joint shaped? How those two bones are shaped against each other. The elasticity of the muscle and connective tissue. So how far we are allowed to stretch from that soft tissue standpoint. Length of that tissue. So how long it actually is, how far we can actually move, and then how our nervous system is regulating our muscle tone, or how much our muscle is turned on at any point in time. If our muscles are on and slightly contracted because our nervous system is telling it to, we won't be able to achieve that range of motion because our body's going to fight our motion. Okay, so if we think about different joint structures, we have different shapes of joints, like hinge joints, like the ones that you see in your fingers or at your knee or at your elbow. They give us the ability to move forward and backwards or flex and extend, but they also restrict other movements like going side to side or spinning. Ball and socket joints like our hip and our shoulder allow us to move in all three planes of motion. They can go forward, backwards, side to side, rotate in and out, and they can combine all of those motion together. So ball and socket joints have more range of motion or more flexibility than hinge joints. Okay, here's an example of your hip joint here. You can see that that ball can rotate in any different position. But the surrounding structures may play a role, like how large your hip socket is, how thick your femoral neck or the neck of your femur is. May allow or not allow you to have specific range of motion. If we have joint breakdown like arthritis, that's going to restrict range of motion because now those two surfaces can't easily slide against each other. And gender also plays a role, gender and heredity. Individuals from different ethnicities and comparing males and females all have different points of more or less flexibility. Females on average have more range of motion than males because hormonally they have more elastin within their connective tissue, so it is more flexible and pliable compared to males which often have more collagen. Okay, with muscle elasticity and length, okay, our muscles and our connective tissue have a specific length and their ability to move. And how much muscle mass and how much connective tissue you have will determine if you have more or less range of motion. Okay, but realistically, it's about how much collagen and elastin you have within your connective tissue, so how pliable it is, and then how much length you are able to achieve. So static stretching or different types of stretching will help to stretch and elongate that tissue, that connective tissue, like your tendons and your fascia and your muscle, stretch it out further. So now you have the ability to have more muscle length and more possible range of motion. That's the purpose of stretching. Okay. Stretching is good. There's not really a bad point to stretching, but there is a problem here when we go to too much stretch, especially in things like our tendons and our ligaments. If we have too much stretch, we can cause things like minor strains or complete tears, which cause injury to that tissue, which then restricts range of motion because now you're injured. So we have some room to stretch, but remember, too much is always too much, and too little isn't going to benefit you. So we want to be somewhere in that optimal range. And when it comes to the muscle itself, muscles are dynamic. They can contract and they can relax, so they can lengthen and shorten based on how our nervous system tells it to function. So we can also add more length to a muscle by stretching that muscle. We lay down longer muscle fibers. Okay, so now we're able to put more fibers in series or in line with each other so we can have a larger, longer muscle. We get a lot of this from eccentric training, or those negative-based training that we talked about in our last section, where you are slowly lowering or stretching the muscle with tension. Can help us get a little bit more range of motion as long as we're using full range of motion in those activities. Okay. With nervous system regulation, our nervous system tells us what to do. Remember, our muscles are dumb. They don't do anything unless our nervous system tells it to. Okay. Proprioceptors are nerves that send information from our muscles and our joints into our spinal cord and into our brain to tell us if we need to maybe contract or relax those muscles reflexively to help keep us safe, or if we need to have a little bit more tension or a little bit more relaxation. Okay. With this, we have some sensors in here called our muscle spindles, which are small little fibers within our muscles that sense how much our muscle stretches and how fast it stretches. So if you're doing some very fast motions and you feel your muscle just reflexively turn on and rebound you back, or if you're doing something like a depth jump where you drop off of something, maybe you jump off a curb and then you try to jump up in the air, that will cause your muscles to reflexively turn on faster than you could do consciously. So it's useful for powerful contractions, but if we're trying to increase range of motion, this is really going to restrict it. So that's one of the problems with more ballistic stretching activities that we'll talk about later. Okay. We also can coordinate this because we know that we can kind of play with our nervous system when we use proprioceptive neuromuscular facilitation stretching. So using a contract and relax model where you are passively stretch and then you contract against that stretch. So you're trying to unstretch actively. When you relax after you contract, your muscle will relax further than it was relaxed before. So we're able to get an even greater stretch than if we were just passively stretching on your own. Okay, so why is this important? Okay, it is important for joint health. If we have limited range of motion, it can cause deterioration at the joint because it doesn't allow all of that cartilage to be loaded and lubricated to allow movement. So we can see some problems there with lack of range of motion. This also comes with the loss of elasticity throughout life. Okay, so as you age, you lose elasticity in your muscles, tendons, and your joints. You build this stiffness, especially if you don't move. If you're someone who is living a very sedentary lifestyle, you're going to lose that elasticity much faster. You're also going to lose your ranges of motion much faster also. So having good flexibility can help us improve our stability and our balance because we're able to move through space. And it's also going to prevent some of that deterioration at the joint because now we're loading it throughout a range of motion and keeping that joint healthy. Okay. We can also apply this to things like back pain and other injuries. Having too much flexibility without any strength is a problem. Okay, so if you have a lot of range of motion but you can't dynamically control it, there's an issue. If you don't have enough range of motion, so you can't get into other positions, that's also a problem. So there's kind of this perfect middle ground where you have the range of motion that your joint should allow, and you have enough coordination and strength to control that range of motion. This is why I recommend full range of motion activities when it comes to your movement. So try to move in different planes, try to move through different ranges of motion and improve your ability to coordinate and have strength in those different positions. So we know that people with high or low flexibility have an increased risk of injury. So this comes back to controlling it. Older adults with low flexibility, high risk for injury. People with high power sports, rapid change of direction without strength in those range of motion and coordination, risk of injury. Workers who do very high intense activities and then are very sedentary, lose range of motion, increased risk of injury. And then people who sit for prolonged periods of time also restrict their range of motion, which then puts a stress on other points when we want to move, but we can't move through that joint. We're going to find that movement somewhere else. So we see this a lot in low back pain. We'll get further into low back pain in a little bit later in the part 2 lecture. But if you're sitting for a long period of time, you lose your ability to extend your hip or straighten out your hip, make it go backwards, which then when you stand up and you try to make your thigh go backwards, you don't have that range of motion. Your body will find it at your low back because it's another more mobile point. So then you're going to stand with kind of this arched back position, putting extra stress on your low back throughout time. And then that lack of range of motion at your hip may be causing pain at your back. Okay, so these are all tied together because flexibility is one joint specific. So if we don't have range of motion at one, our body's going to try and find it somewhere else where it probably shouldn't be. Okay. So we have some other benefits, reliefs of aches and pains. If you're sore, stretching often helps relieve that soreness because it relieves some of that muscle tension. It can relieve cramps and other tense muscles, cause some relaxation, give you the ability to achieve better posture and balance. So if you're doing especially things that are dynamic stretching where you have to control end range of motion, so as far as you can move and then control it, improving that ability is going to improve your posture because now you can sit up straight because now you have more range of motion at your back, your hips, maybe it's your upper back, maybe it's your shoulders. Wherever you're missing range of motion, practice actively going there and controlling that range of motion. Okay. When it comes to assessing it and testing for it, flexibility is joint specific, but we often use something like the sit and reach test to give you a broad assessment of low back and hamstring flexibility, but it's not the best test. It's an option. If you want very specific range of motion assessments, I like to use side-to-side comparisons. So if you have a lot of range of motion on one side and not on the other, there may be a problem. Okay, so trying to find those what's normal and then make sure you have control of the range of motion that you can achieve. Okay, then you need to create a program to develop more flexibility if you needed it or to maintain flexibility. We have to apply our FIT VP principle, okay, frequency, intensity, time, type, volume, and progression, because we always have to keep moving forward. Okay, we recommend 2 to 3 days a week when the muscles are warm. So I recommend if you're going to do 2 to 3 days a week of cardiorespiratory endurance or resistance training, use those days or right after those exercise days to be your stretching days also. Helps you condense all that exercise time, and you're going to get the most bang for your buck out of your flexibility training. Okay. We want to push or stretch our muscles slowly until a point where there is discomfort but not pain. And then we want to hold that stretch for 10 to 30 seconds. Okay, this is static stretching. We don't want to go to pain. Pain is a problem. Pain is going to cause our muscles to tighten up and we're not going to get that range of motion. We want to have some tension and then we want to relax into that tension and cause it to relax that muscle over that 10 to 30 second period. Okay, and then we want to rest about 30 to 60 seconds for each stretch. That means that you can go 30 seconds on the right, 30 seconds on the left, and then back to the right. That's still 30 seconds of rest for that opposite side. So you can get some more condensed exercise and put it all together so you don't have to sit and be sedentary in between. It shouldn't take you longer than 10 to 30 minutes to do a great flexibility workout, okay, or flexibility exercise session. Okay, so what should you do for your stretching sessions? Static stretching is best when we are warm and when we are done with our exercise. Okay, it stretches that muscle gradually, improves some range of motion, reduces that muscle tone that comes from our active proprioceptors that are telling us that we need to tighten up in different places. So I recommend this as kind of on its own, maybe first before your warm up or after all of your exercise. With dynamic stretching, I like to use this as a warm up. So we're doing activities where we challenge balance and coordination and try to push ourselves to end ranges of motion while we have some kind of muscular activity also. Okay, so these are things where we're doing like a dynamic warm-up, where you're putting yourselves into different positions using things like lunging, stepping, squatting, pushing, moving our body, twisting, rotating, and controlling our movement. Okay, we can also use ballistic stretching, but I do recommend this for more well-trained athletes after a warm-up. These are active bouncing stretches where you're trying to go to end range of motion and rebound out. These actually increase the activity of proprioceptors, so it makes us a little bit more quick and fast, but I don't recommend it for anyone who is not trained and coached specifically in these activities. Okay. We can also use things like PNF stretching, proprioceptive neuromuscular facilitation stretching, where we're doing contract and relax activities. I recommend doing them with a partner, okay, where someone is stretching you passively, contract against them, and then have them actively pull you into more range of motion. It can allow you to improve range of motion for a quick period of time, but it only lasts for a few hours maybe, because it is more of a trick to your nervous system rather than a long-term chronic change. Okay. When it comes to passive versus active stretching is when we use an outside force to put us into range of motion. So maybe you're using a band, you're using a wall, you're using a weight, you're using a partner to put you into end range of motion. Active stretching is what we do, especially with dynamic stretching, is contracting of different muscle groups to relax others. Okay, so maybe you're trying to stretch your tricep so you contract your bicep. You're trying to stretch your quadricep so you contract your hamstring. Trying to stretch your hamstring so you contract your quadricep. If you contract the opposite muscle group, it will relax the one that you're trying to stretch. So if you're doing a toe touch stretch, or maybe a hamstring stretch, of one that's on the back of your thigh, and you contract your quad, your thigh on the top, that is going to increase the relaxation of your hamstring and allow you to get more range of motion. Okay, and then continue to test yourself using the same different types of tests that you've been using, and then see if you have improvements. It's going to take a few months to see real chronic improvements and long-term change. And then we have to keep doing this over time to maintain our flexibility. Okay, my best recommendation to maintain flexibility: move through full ranges of motion every day. Okay, try to get yourselves into different positions where you are going to the end and creating some dynamic control. So here's some example programs, some example exercises. For your lab this week, you're going to demonstrate an activity. You can demonstrate any of these on here. If you don't know how to do them, you can look in your textbook, or you can use the magic thing called YouTube or Google, and maybe learn from someone who's has more experience in this activity, and then you can also teach it. But here are some different ones. I like to use a lot of different lunge stretches and specific stretches to improve coordination and range of motion. All right, thanks for watching part 1, and we'll come back for part 2 on low back pain.